I'm Dr. Allappa Banikar, consultant pediatrician, Lovely Kids Clinic. I am practicing pediatrics from the past 21 years. I graduated from Jawaharlal Nehru Medical College, Belgaum. I did my post-graduation from the Government Medical College, Mysore. I did my fellowship in CMC Vellore, prestigious CMC Vellore. I am attached to many corporate hospitals like Manipal Hospital, Jayanagar, and Rainbow Children's Hospital and Cloud9 Hospital also. I interested in mainly newborn care. I attended almost more than 10 to 15,000 deliveries during my career, and I'm mainly interested in pediatric ICU care also, and vaccination, the nebulization services, and we will provide all the holistic approach to the children. This is a monsoon is coming now. Okay, still not at all, but about to come. The rainy season, as the schools opens up, there are many children are sick, fall sick, like with common cold, running nose, fever associated, and the children do go to school, and from the one children to other child, the viral infection can be commonly affected. Majority the infections are flu related infection, and we have one flu vaccine that will help to prevent the to certain extent 70 to 80% infection can be prevented with the flu vaccine. The flu vaccine will be available in our clinics. Hi, I am Dr. Allappa Banikar, consultant pediatrician, Lovely Kids Clinic. I have vast experience in the field of pediatrics of 21 years. I graduated from the Jain Medical College, Belgaum. I did my post-graduation from Mysore Medical College. I did my fellowship in allergy and asthma in pediatrics in CMC Vellore. I have attended almost 10 to 15,000 deliveries during my career. I mainly very keen to work in the newborn care as well as in pediatric intensive care. I attached to many corporate hospitals, Manipal Hospital, Cloud9 Hospital, and Rainbow Children's Hospital. This is a monsoon season is arriving. As the children are going to school, they are mainly infected with many viruses, including the influenza viruses, and they have commonly there every 15 days, 1 month they'll be falling in sick with cold and cough and fever. And we have a flu vaccine which is available in our clinic that helps to reduce the infection to the extent of 70 to 80%. Kindly take the vaccine for the children. There is an entity called as hygiene hypothesis. As you know, everybody knows now hygiene is good to reduce the infection, but excessive hygiene, like in turn, it will reduce the infections like bacterial infection, but that will again counterbalance, it will increase the viral infection, the chances. We call it as hygiene hypothesis. In direct, they will increase the allergy tendency will be there. As especially we will see in the US children, the Indian children born in India, they gone to US, they have more tendency of this this one, infections and all. Okay, they have to be balanced. That's the thing. About the school structure, one is excessive pressure by the parents itself, and there is excessive because what the parents could not achieve in their younger life, they want to achieve it through the kids. That is the one, because everybody want to be the first in the child. Suppose if 15 children are there in the school, everybody want to be first. How it is possible? And even the school, even school pressure is also more, because the school, they want to show their number one in the area, number one in the Bangalore. The excessive pressure also will be there, and school timings also. Ideally, the school timing should be 9:30 plus that 10 o'clock. What you used to see in the rural area, but nowadays every school start with 8 o'clock, early morning get up. If they don't have the night sleep and all, their school will be affected. And overall, the excessive pressure from the parents and from the school and from the and competition also. You earlier used to call NEET examination for the medical entrance. We used to start on the second PUC only used to start now it starts in the fifth only. They are starting now NEET coaching. That should not happen, because the learning should be without pressure. It should be there, ideally. And definitely, if the pressures are there, the performance, what the optimally the child suppose the child is performing 100%, that will come down to 60 to 7%, and real inner talent of the child cannot come, and all children are doesn't look like same, because the certain children will be good in maths, certain arts, there are certain drama activity and all. But according to that, you have to nurture the child, not the only the marks or only the examination curriculum that will determine. Regarding what you asked, God has a screen time. Screen time means it includes mobile as well as the TV. We have, Indian Academy of Pediatrics and American Academy of Pediatrics, we have certain guidelines. Up to 2 years, there will be no gadgets as such. There is no screen time should be there. Maybe like 2 to like 5 years, half an hour a day, it can increase. Even if you are stopping it, that's well and good. But minimum it should be like maximum it should be half an hour. Like that, depending on the age criteria, they have given certain, like in the like school going children, maximum half an hour, including the advertisements, everything should be there, and it should not be more than 1 hour. When the screen time increases, their academic activity, their physical activity, everything come down, and their consumption also will increase. They are likely leads to not only the intellectual deficiency, as well as they have the like nutritional deficiency also. They will that induces the nutritional deficiency, that induces the obesity related problems. And actually the gadget should not be given as much as possible. If it is only, it is during the feeding time, you should not give the gadget as such. Only you have to make the feed baby properly, sit and feed them. That's it. Whenever there is a, because it is a near vision, you are not developing the distance vision as you are, because the 3D vision will be there when you are playing outside. The 3D vision, distant vision, everything, eyes health will be better with the outer game playing. And apart from that, you will be playing in the sun and all. You will get the sunlight exposure. You will get the vitamin D and all production will be there. And other, like no, it will be general all over, and physical exercise will be there. But in the if you are giving them gadgets and all in the mobile game, all activity will come down, even nutritionally, as well as the vitamin D deficiency. All other deficiency will be associated with the only the indoor sitting and playing with the mobile games. That's the thing. Medi-Talks is a new organization which is emerging in the field of healthcare, as they are providing medical emergency services, and they are keen in developing, and they are currently concentrated in Bangalore, and that is helping a lot for us as pediatricians to collaborate with the Medi-Talks. Thank you.